This is our May Daisy Award ceremony for the extraordinary nurse. As you well know, it is September. We have an exciting bug called COVID-19, so life is different. So our Daisy presentation is also different. So it's very limited to what we have today. And thank you for being here. I always do want to explain why it's important that we have a Daisy. I have such compassion for this award. I saw the family, I saw how they felt, and the hearing that you thought that nurses should get. So it's I have much compassion for this. Again, the Daisy Foundation was established in 1999 by members of the family of Patrick Barnes. He was a 33-year-old and died of complications of autoimmune disease, ITP. Like many families we see every day who go through this kind of horrific loss, the Barnes family wanted to do something positive to honor this very special man Patrick was. So as they say over a liquid dinner, right after Pat's death, they came up with the DAISY. It's an acronym for Disease Attacking the Immune System. As they brainstormed what Daisy Foundation would actually do, they kept coming up back to those positive things they held on during Pat's 8 weeks of illness, that extraordinary care he received from Pat's nurses. The family were very impressed by the clinical care Pat's nurses provided, with how overwhelmed they were with the compassion and kindness that his nurse brought to the bedside day in and day out. The nurses' sensitivity made a great difference in Barnes' experience, and they wanted to say thank you to nurses for those extraordinary care that they provided patients and family every day. So Pat's family created the Daisy Award for Extraordinary Nurses. We started out as a thank you from the family to the nurses, have grown into a meaningful recognition program embraced by thousands of healthcare organizations around the world. There are multitudes of these people out there. We are very proud to partner with Daisy as we have extraordinary nurses here at Union Point Finley, and we do. Each one of you is a Daisy. So we will go ahead, and the winner will get a Daisy Award pin, and she's that extraordinary nurse. And I will tell you who the nominees were. The following nominees for the May 2020 Daisy Nurse Award included Steve Day from ED, Turney Delsing from 5Med Surg, Nicole Monahan from Family Birthing Suites, Christine March from 4Med Surg, and Marie Grevas from 4Med Surg. Okay? And then Heather Hines. I shared her over with her earlier. Thank you, dear. So, it's hard to say who's the best or who's the extraordinary. I would have anyone take care of me. You all are great. But we do have an extraordinary among us. And the winner is Marie Grevas. Would you like to share the story? Okay. I'd like to share the story. It actually came from a family who nominated you. So Tara's going to read the story.
Marie, here's your story. This nominee leads by example and exemplifies a nurse who consistently functions as a skilled clinician, a true patient advocate, dedicated mentor, insightful educator, and a sensitive caregiver. The nominee is a team player, and coworkers feel working with her is a gift. Furthermore, the nominee pays close attention to the emotional and psychological needs of the patients. Each patient is treated as a human being who has a personality, a history, a time of good health and strength, value, and dignity. Marie Grevas, here is your story. My mother was admitted to the hospital on February 5th, 2020 for the last time, battling congestive heart failure, atrial fib, leaky heart valves, and COPD. Her heart just couldn't circulate enough blood efficiently, and she had worsening episodes of breathing or the feeling that she was suffocating. Marie was one of the day shift nurses on 4Med Surg that cared for my mother each day. What a kind and compassionate caregiver. She was so gentle with Mom. She always made Mom smile and perk up when she heard her sweet voice. Marie kept Mom comfortable and was right there whenever Mom needed anything. She explained to Mom and anyone else in the room exactly what she was doing and why. Marie always asked my mom if it was okay to do the things that she was doing. Before she would leave the room, she always made sure we had everything we needed. Marie is the template that all nurses should be cut from. And I am sure that the student nurses working with her could not have had a better mentor.
Because the daisy, your daisy flowers.
Oh.
Congratulations. No surprise at all. Great job.
Thank you.
Thank you for being a part of our mission.
And then Mary will give you the healer touch sculpture. This is a beautiful sculpture for you. It's called the Healer Touch. It's about a beautiful recognition of the bond between nurses and their patients. These sculptures are hand carved by the artist in Zimbabwe, and each piece is signed by one of them. So it's individual, so everyone will have the same one. So thank you for being a thank you for everybody coming. Of course, along with the daisies, Patrick likes cinnamon rolls, so that is part of the award, because when he had a cinnamon roll, all the nurses had a cinnamon roll. So, thank you.
All right.